Bone on bone isn't a real medical term. There's no billing code for bone on bone. It's made up. It's like calling a redheaded guy a ginger. Yeah, I said it. There is no code for bone on bone. And if you chat GDP it or you Google it, it's going to say it's not a real medical term. But that's all everybody says. And when they say you're bone on bone, they're prefacing it because they're going to tell you have to have that joint replaced. Have to have that joint replaced. But you're walking. You're playing pickleball. You're riding your bike. Why do you have to have that shoulder replaced? Right? I mean, shoulder replacement's not like a colonoscopy. It's not a simple surgery. It's a very large surgery. That's why it's done in hospitals. Okay? More importantly, what is the problem you're solving? Well, if your problem is pain, sawing off the end of your bone is a very dramatic way of solving your pain problem. Why don't we just stop the pain and fix the problem without sawing off your joint? Right? If your joint's compromised, you're in a wheelchair, it's collapsed, okay, that's different. But if you're walking on your own, there's nothing wrong with your hip or your knee or your shoulder or any other joint, right? You have a problem with pain. Now, your knee has two kinds of cartilage. The meniscus, right, which makes the space. So if you have lots of meniscus, you have lots of space. If you have no meniscus, it looks like there's no space, like the bones are touching, bone on bone. Well, guess what? It's the biggest bait and switch in medicine. I said it. When you're bone on bone, that tells the surgeon that you don't have a meniscus. Oh, yeah. Thanks, Dr. Dean. Well, guess what? If you don't have a meniscus, your meniscus can't be causing pain, right? There's nothing there to tear and flip-flop and get stuck. That's all bone on bone means. Because the surgeon has two tools. He has arthroscopy, scope, and he has replacement. If he says you're bone on bone, then he's telling you your meniscus isn't causing your pain. Therefore, arthroscopy is not an option. The only other tool in his box is replacement. He's going to saw off the end of your bone. Bone on bone simply means you don't have a meniscus, and arthroscopy is not going to help you. Bone on bone doesn't mean your joint's compromised in the sense that it doesn't work. If a 20-year-old baseball player tears his meniscus, it hurts. He can't function. It's awful. So eventually he has surgery. And they remove that medial meniscus because it's all torn and flip-flopping and it's just miserable. He goes home, gets better. 6 weeks later, he's out playing ball. He's happy. Right? Well, if you x-ray his knee, he's bone on bone because we physically remove the medial meniscus. Bone on bone. But he doesn't have any pain. The surgeon's a hero. He's playing ball. Everybody's happy. So what on earth is going on? Like I said, your meniscus has nothing to do with your pain when you have arthritis. You see, on the end of your bone, you have a second cartilage, this blue stuff. And this is the same stuff you see on the end of a chicken bone. Yeah. The hard white stuff on the end of a chicken bone. That's what this blue stuff is. That cartilage is different than your meniscus. The meniscus is type 4 cartilage or collagen. This is type 2 cartilage or collagen. And this cartilage is a hard shell protecting your bone because your bone's alive. We have bone marrow, we have blood vessels, and we have nerve endings in our bone. Okay? So we have this hard cartilage that coats the bone. It's harder than the bone. So on an x-ray, it looks like the outline of a bone. If you do an MRI, you'll see the rim of that hard cartilage all day long on an MRI. Okay, but on an x-ray, it just looks like the outline of the bone. What's causing your pain? Arthritis, osteoarthritis, awful. But guess what? It's not the bone spurs. Bone spurs don't cause pain. Those bone spurs have been there for years. It's not the sclerosis, which is more calcium density in your bone, the opposite of osteoporosis. And it's certainly not your meniscus being there or not being there. It's something called chondromalacia. Chondromalacia. And what chondromalacia is you start to get little cavities in this hard chicken bone cartilage. Because this cartilage grows every day of our lives. They're chondrocytes, little cartilage cells that produce the collagen. The problem is as we get older, things don't grow as fast. But we're active, we do things, we wear out the meniscus, the biomechanics change. We're beating up the cartilage faster than it can heal. So we get little cavities. And just like a tooth cavity, you may have it for years. No pain, not going to get it filled. And then one day it gets just deep enough, even if it's the size of a pinhead, where it hurts. And that's when we go to the dentist. The dentist looks in our mouth, does an x-ray, and says you have a cavity. If it's a simple cavity, he's going to fill your tooth. You go home, life is good. If it's a bad cavity, but a good solid tooth, they're always going to try to save your tooth. So how do they do this? Well, they might do a root canal, treat the pain, treat the infection. But if it's a good solid tooth, they're going to try to save it and then fill the tooth. Unfortunately, sometimes your tooth is not salvageable, right? It's cracked, it's broken, they can't save it. That's when you get a crown, right? I'm sure lots of people have had crowns. I've had a couple of crowns. How does a crown stop your pain? Well, they grind your tooth down. And when they grind your tooth down, they remove the nerves in the tooth that are causing your pain. Now your pain's gone. You're happy, everything is great, but you don't have a tooth, right? So they have to make the cap, the porcelain cap, and glue that to the little post. And then, of course, now you're happy. That's what a crown is. When your internal medicine doctor sends you to the orthopedic surgeon to treat your osteoarthritis, the surgeon has arthroscopy, has knee replacement. Osteoarthritis is a medical disease. It's not a surgical disease. But today it's become a surgical disease because the rheumatologists, the arthritis doctors, don't have anything but Advil and steroids to give you. How is this surgical procedure, knee replacement, solving your pain? Well, they're going to saw off the end of your bone. And when they saw off the top bone and saw off the bottom bone, they're removing those nerve endings that live in the cartilage where you've got little cavities. Just like grinding down your tooth when you have a crown. Now your pain's gone. It's great, but unfortunately you don't have a knee, right? So they've got to put the titanium implants there, robotically assisted 3D image titanium. It's just a cap. It's a crown. It's a prosthetic. You want to have a porcelain crown, you want a gold crown. All the technology that's advertised in knee replacement is to fix the problem, which is they just sawed off the end of your bone. So if your joint works, you're walking, you're doing things, and you just have pain and you get inflammation, well, why don't we not saw off your joint? That's what our emotion is. Let's stop the pain, turn off the inflammation, help heal the cavities. Done over 7,000 people now. It's pretty neat when you follow them for 8-9 years and they're good. You don't need to have your knee replaced if you're still walking. Come see us.